Hi there, it's Nurse Pat again. I'm here to talk to you about sugar. Now, you go to the doctor and he's like, well, I draw your blood and your A1C isn't good. We need you to figure it out, and we need you to change your diet and do some exercise and decrease your A1C number. And you're like, okay, doctor, whatever you say. But then you're like, I have no idea what A1C is. What's he talking about? I'm going to try to give you some knowledge on what A1C means. Now, A1C, you can tell your doctor, well, doctor, I've been exercising. I've been eating those salads every day. I try to walk, and I really try not to drink that pop and that sugar, but, you know, I'm doing my best, and that's all that's required. It's your best. But when the doctor draws your A1C, it can show them exactly what you're doing, because the A1C is a number that shows them 3 months worth of blood sugars. Our blood cells, the red cells, renew every 90 days. So what you start doing or changing with your diet today will reflect in your next 90 days when you get your A1C done. So I've got the numbers for you so you can kind of see where you're going and where you're at. Now, here's the chart. If you're 6, they like below 7. Most doctors do, but you have to find out from your doctor where he wants you to be. If you're at 6, for 3 months, your average is at 115. 7, you're at 150. So that means you average between these numbers. If your A1C is 8, your average sugar for 3 months is 180. So it's here between here and here. If your sugar is 9, it's 215, and it's above 8. And a lot of times they say that anytime your sugar goes above 200, it might do some, medical damage to your body, like the neuropathy and, your sight. That's why you have to get your eyes checked every year to make sure everything's good. If you're at 10, your A1C's at 10, your sugar runs at 250. That's your average. 11, your sugar average is 280. So that means your sugar runs around 280 for 3 months. All these is the 3 months average. If your A1C is 12, that means your sugar average is at 315. That's where the average is for 3 months. 13, your sugar average is 350. And at 14 A1C, your sugar average is 380. Most doctors like 7 or below, so 150 average, and that's all day. Not just your morning sugar when you get up. That's 24 hours. So for 3 months, he wants it average around here. So it might go a little bit above, a little bit below, but this is the average he wants. And that's what he means when he says we need to fix that A1C. Thank you, and I'll see you next time.